We at MD Coaches know that match is a stressful time. If your match results were not what you expected, you might need the time and the space to explore what's next. MD Coaches is proud to offer a comprehensive 6-week virtual group coaching program that explores your unique value and possibilities beyond the match. We're offering 4 separate rolling cohorts, Sundays, April 7 through May 12, or May 19 through June 23rd. A second option is Thursdays, May 2nd through June 6th, or June 13th through July 25th. All sessions begin at 7 p.m. Eastern Time. You can register today at mdcoaches.store/medical-student-coaching.
Regular listeners to this podcast know that we focus on inflection points in guests' lives and discuss how they navigated through those times. Listeners may have also noticed that occasionally the show revolves around physician well-being, such as the last podcast with Dr. Jonathan Fisher. In many ways, this is an inflection point for our whole profession. Physician burnout rates continue at the same level prior to COVID, and the rates of physician and attrition and suicide remain deplorably high. On the bright side, more and more healthcare systems, practices, and medical education centers are intentionally attending to professional well-being. For the next several episodes, we're going to explore this topic more deeply. First, with some physicians who are actually in the trenches of both clinical practice and research, who will speak firsthand what some of the contemporary challenges are. Then, we'll be discussing with chief well-being officers to learn how they see the problem of physician dissatisfaction and what they feel are steps to turn it around. We really are at a branch point. If we don't figure out how better to improve the professional lives of physicians and other healthcare professionals, healthcare itself will, and I would argue already does, suffer. To kick off this series, today's show is a series of conversations that I had with family medicine physician, the specialty that consistently ranks among the top 3 highest for burnout rates. I recently attended the annual conference of the Society of Teachers of Family Medicine, aka STFM. This organization has, since its inception, been at the forefront of family medicine education, primary care scholarship, faculty development, and health policy. While at the conference, I attended several sessions in which the theme had something to do with burnout or well-being. Fortunately for us, many of those presenters agreed to be interviewed. All of them have been involved in education, research, and awareness raising around physician well-being. As you'll hear, I was after their perspective on the most important things that healthcare systems, practices, and hospitals should be doing to improve the well-being of the healthcare professionals that work in their systems. Listener warning, but as these were conducted at the conference, you'll sometimes hear the usual din that accompanies such meetings. So, without further ado, let's kick off this series about physician burnout and well-being by hearing the voices of those who are living and thinking about it a lot. There are times in our lives that change the way we see the world. Navigating these challenges can take insight, trusted confidants, or even a coach. Let's explore those moments. In this companion podcast to RX for Success, we will discover ways to learn and write our own success stories together. I'm Dr. Dale Waxman, a physician coach with MD Coaches, and this is Life-Changing Moments. Dr. Krishna Desai is an assistant professor and the director of integrative medicine at Columbia University, New York Presbyterian Hospital in New York City. She spoke eloquently about the issues that occur as a physician in practice and also someone who teaches residents and medical students. What do you think programs, departments, healthcare systems, institutions, all of those entities that are involved in where healthcare professionals work, what should they be doing to improve the professional well-being of the physicians?
Yeah. I think there are a couple of things that are top on my mind that we can leverage. First is the use of AI and leveraging it to reduce our administrative burdens, which then also allows for part two, which is to spend more meaningful time with our patients, doing meaningful things that drive us to be passionate about what we do, right? So why did we enter the healthcare field in the first place, and remembering that, right? So for me, that's integrative medicine and spending time with my patients. And if I'm outsourcing my administrative time, like scribing of notes, right? There are many platforms out there now that you can use for scribing your office notes and managing your inbox. And for me, as an associate program director, using artificial intelligence for evaluation systems and using feedback and documentation and an AI that can create a summative evaluation for me based on a rubric that I put in. So reducing the administrative burdens, and for us to recognize that there are a lot of limitations for AI, and for me to use my humanistic critical thinking to look at whether, the final product of what it's producing is something that is acceptable to me. And so I'm spending a lot less time editing those final products rather than starting from scratch and creating them, which then leads, more time for me to spend with my patients, with my learners, doing the things that I love doing.
That's awesome. Anything else you want to add to that?
Yeah. I think there are different also groups of people that are disproportionately affected by the burdens of our healthcare system, including our residents and learners. I think they're
what specialty?
I'm in family medicine, so that's what I know. But I think that this is relevant to really any specialty that you look at, and I think we still treat our residents as workhorses, which doesn't leave enough and sufficient room for learning and for well-being and for patient-physician therapeutic relationships. And I think it's important for us to recognize that there are groups of people who are disproportionately also affected. Women also, particularly women who are trying to advance their careers in academic medicine, and that they have a lot of competing interests, like their family lives and pregnancy, et cetera, breastfeeding, and the amount of time that you receive to be able to, do all of those and wear all of those hats in a way that we feel is successful. So yeah, I think equity in looking at these different groups of people and what their needs are, and that they're individual, and to explore that a little bit more and thoughtfully, and to create systems that are for those folks.
Support those.
Yeah.
Next, I spoke with Dr. Jason Marker, who is the General Chair for the Leading Physician Wellbeing Certificate Program for the American Academy of Family Physicians, and is also Associate Director of the Memorial Hospital Family Medicine Residency Program in South Bend, Indiana. I attended his presentation about that combination of leading physician well-being through both leadership training as well as orienting attendees to the issues of well-being. Can you just first tell us a little bit about what your professional role is right now?
Sure, thank you very much. I'm a core faculty member at the Memorial Hospital Family Medicine Residency Program in South Bend, Indiana, and I'm also the General Chair of the Leading Physician Wellbeing Program for the American Academy of Family Physicians.
Which is why I wanted to talk to you. You did a great presentation about how to blend leadership work, leadership training along with well-being work, which I thought was pretty brilliant, a nice hybrid of it. So what I'm asking people around here, especially people who have been thinking about this for a little while, is what are one or two or three things that you think is most needed right now to improve the well-being of healthcare professionals, specifically physicians in our country?
I'll give you a couple right off the top of my head.
Yeah.
First is personal, and that is to say we need to gain insight when we've had enough and be bold enough to acknowledge that we're going to need to focus on ourselves. Too many times there's just so many things put on our own shoulders, we can't even think clearly enough to say, this is not right and I need to take care of myself better. We need to get ourselves to a place where we can acknowledge that and notice it and begin to take that really seriously. Now, as soon as I say that, I back right off of it because this is not really our problem. This is a systemic problem, which leads me to my second point, which is once we have that boldness about us and we've got whatever skills in us that we need to be able to have, it's about beginning to deconstruct the systemic things that have led to the burnout epidemic. And those are not necessarily hard to identify or hard to solve. It's hard to get buy-in from the right people to make the changes happen. So personal well-being has to be tied with professional, systematic changes in the environments that we work in.
Is there one or two of those systems things that are hard to get buy-in by that you can think about right now?
Anything that costs money.
Yeah, of course.
If it's something that needs to change that's going to have a lot of financial inputs, that's hard for C-suite folks to see their way to doing. You're going to have to sell this on the matter of how it improves the physician workforce and will ultimately trickle down into better patient care, which from the C-suite lens is going to lead to better throughput and financial output along the way. So you got to speak their language. If you're not comfortable doing that, that's one of those things you need to sort of grow into as you begin to work in that systemic space.
Yeah. So what I'm hearing you say is it's really not difficult to identify those systems issues that are that barrier between physician and patient, as we've heard about so many times at this conference as well.
You can ask any physician, any resident, any family medical student, like, what are the things that aren't working right with the U.S. healthcare system, or even just within your own system, or what didn't feel right about today's clinic? And they can tell you for a half hour those things. Like, it is not hard to find the targets for success here. It's hard to get the levers of power pulled in the right way to make the changes happen.
Are you a doctor struggling to provide the best care for your patients while dealing with financial and caregiving matters out of the scope of your practice? Do you find yourself scrambling to keep up with the latest resources and wish there was an easier way? Then this virtual caregiver conference resource will save you time, money, and sanity by giving you all the resources and information your patients need in one place. This conference helps you and your patients enlist the best strategies around healthcare resources and the best financial steps for your patients while navigating caregiving situations. You don't have to go home feeling frustrated and helpless because you couldn't connect your patients with the best services. Find out more at jeanniedoherty.com or click in the link in the show's notes. You don't want to miss this caregiver resource.
Hi, I'm Rhonda Crow, founder and CEO for MD Coaches. Here on RX for Success, we interview a lot of great medical professionals on how they grew their careers, how they overcame challenges, and how they handle day-to-day work. I really hope you're getting a lot of great information. But if you're looking for an answer to a specific problem, management or administration challenge, or if you're feeling just a bit burnt out, like maybe you chose the wrong career, well, then there's a faster way to get the help you need. No, it's not counseling, it's coaching. RX for Success is produced by MD Coaches, a team of physicians who have been where you are. I know you're used to going it alone, but you don't have to. Get the support you need today. Visit us at mymdcoaches.com to schedule your complimentary consultation. Again, that's mymdcoaches.com, because you're not in this alone.
We'll get back to our interview in just a moment, but right now I want to tell you a little bit about Physician Outlook. If you haven't discovered this remarkable magazine, please do so very soon. It was created by physicians, for physicians, to showcase the intersection between clinical and non-clinical interests, whether it's writing, painting, cooking, politics, and dozens of other topics. Physician Outlook gives a physician perspective. It's available online and in print. It's really unique among physician lifestyle magazines. And like the Prescription for Success podcast, Physician Outlook amplifies the voice of any physician who has something to say. It also engages patients who still believe in physician-led, team-based care. And Prescription for Success listeners can get 3 months free when you enter our promo code RX for Success and select the monthly option at checkout. That's a really great deal on this stunning publication. And now let's get back to today's interview.
Next, I spoke with Dr. Leah Bruner, who is an assistant professor of family medicine at the University of Georgia in Augusta. So I'm going to ask the same question I've been asking everybody else. I'm going to ask it a little differently. What's the top of mind for you about what are some things that practices, healthcare systems, hospitals, healthcare organizations need to most attend to regarding improving the well-being of physicians?
Right. Well, I think there's a number of things, but as a co-chair of the Women in Family Medicine Collaborative at STFM, we are concerned because women are burning out at higher rates, and there are higher rates of suicide in women. So that's a really concerning thing. And when you look at some of the gender differences, I think there's a few things that come to mind that could be helpful. One thing, just in general for physicians, is making sure that practices are adequately staffed, both with clinicians, but also with the MAs and nurses, to make sure that those tasks don't get put more on the women faculty than on others. I mean, I think that it does contribute to things. And women get 25% more messages, both from staff and from patients in their in-baskets, and spend 20% more time in their in-baskets in the EHR. And so we want to make sure that they're supported. And it's not that women are less efficient. In general, their efficiency measures are higher, but it's that the demands are higher. And then patients also expect different things from their female physicians than they do from men, and generally have higher demands there as well. So staffing, I think, is something that would be helpful. I do think also that because there are demands, often are more caregiving demands on women, both as for children and elders, having onsite daycare would be very helpful for women who, when their kids are sick, there needs to be a place that the children can go. Otherwise, if their partners aren't able to help either, then it leads to not being able to come to the clinic, and that causes certainly loss of revenue and increases the burnout as people are trying to make sure that they can fulfill their jobs. One other thing that is interesting to me is that, there's a pay gap in terms of women, and it's about, in family medicine, it's about 91 cents on the dollar compared to men, which doesn't sound like as much. In overall academic medicine, it's 76 cents on the dollar for women. But even the 91 cents on the dollar adds up to a whole lot. When you compound that over a career, it's over $1 million difference in terms of the compensation. And one of the things that may be behind that is that in general, women end up doing more of the non-promotable work. So things where you're doing the coordination or helping with the in-basket. There's lots of different things. If you're in meetings, you're the one doing the minutes, or those sorts of things that are not
as revenue producing.
They're not as revenue producing,
yeah.
Absolutely. And so we know a couple of things. Women are more likely to volunteer for those positions, so it's partly on the women, trying not to take on more of that than needed, but these are all tasks that have to be done. And so finding an equitable way to distribute those. We also know that women are asked to do those things more often, and more often are accept doing them. So if we had a rotation, or it was assigned on a rotating basis for those things, so that it was equal among the people and not just the same people over and over again that are taking on those tasks that again are necessary for the organization, but they're not going to contribute to pay and not to promotion. So,
wow.
So I think that's a big thing.
Leah, thank you so much.
Yeah.
I mean, you did a lot there in just a few minutes. I really appreciate that. For me, I thought I was aware of a lot of this, and you just raised a lot of awareness for me, and now for our listeners as well. That was really amazing. And I think that's our work, is to raise awareness about these issues. Absolutely. And then adjust because of the way things are. And so I really appreciate it.
Absolutely.
Thank you, Dr. Leah Bruner. Thank you for joining us on today's episode of Life-Changing Moments. We hope you found the insights from these physicians at a conference both inspiring and thought-provoking. In our next episode, we will be hearing even more voices from this same conference. Improving physician well-being is crucial for a healthier healthcare system, and your input is invaluable. To that end, we'd love to hear your thoughts on what health systems should focus on to support physician well-being. Please visit our SpeakPipe link in the show notes to leave a voice message with your ideas, experiences, and suggestions. Your contributions may be featured in a future podcast episode, helping us continue this vital conversation. Remember, your voice matters. Together, we can make a positive impact on the well-being of physicians everywhere. Until next time, take care and be well. Thank you for tuning in to Life Changing Moments. If you enjoyed this episode, please be sure to rate us 5 stars and leave a review. Doing so helps our podcast reach more listeners. Have something to share? We'd love to hear your thoughts. Visit the MD Coaches community on Facebook groups. This dynamic virtual space is a place to continue discussion about life-changing moments and perhaps share some life-changing moments of your own. Join the conversation today.